as a doctor,
Mhm.
would you go pick up the phone and call 911, or would you assign that to maybe someone else?
I think if there is somebody around, the first rule is to have that person call them. But if you are alone and there is nobody and you don't have the resources, you have to call 911 yourself right away.
What if someone's in the next room?
You can call out for that person, and if there is an immediate response, that would seem reasonable.
And you would be reasonable to tell that person that you need help and to get security?
No.
If security theoretically is within a matter of less than a minute, 30 seconds away from your position there to this door in the back of the courtroom,
No.
you wouldn't go that far to get security?
No, I would want 911 called. Security is not going to provide any additive help to what I'm capable of doing, but the resources through the paramedics and the fire department are.
So you don't think that the designation of someone else to get help while you tend to the patient would be appropriate?
No, a designation for them to call 911, not to just inform them to come or just to let them know. The designation for that person or individuals to immediately call 911. That is what I'm referring to as being appropriate.
Do you know anything about the security arrangements at the Jackson House?
I'm not aware of those details.
Do you know that there was a front gate that's locked?
I've heard that, but I'm not very, I don't know the exact details.
Are you aware of the fact that nobody gets in that front gate without security letting them in?
Your Honor, 352.
I'm going to sustain the objection under 350.
Okay. How long would you spend on the phone with 911 before you went back to the patient?
I think most of us that have ever encountered calling 911, you would understand that it's really seconds. I mean, when you call 911, it's not like you're put on a voice recorder and put on hold. It is immediate.
Well, when you're using a cell phone, is it as immediate as when you're using a landline? Do you know?
I'm not sure what you're...
Are you aware of the fact there was...
Vague, beyond his area of expertise.
I'll overrule the objection.
You don't know?
I'm not, no, I don't know what you're referring to.
Are you aware of the fact there was no landlines at the Jackson House?
I did read that in the notes, yes.
Okay. Do you know whether that's a complicating factor in calling 911?
I think if you have a cell phone around, you can dial 911 through your cell phone.
Okay. Did you hear that the person that did call 911, it took them 2 minutes and 43 seconds on that phone call?
To make the phone call? I object
That's
is
the
vague.
objection.
Vague.
Sustain.
The 911 call that was made, are you aware of the fact it was 2 minutes and 43 seconds?
Overruled.
I don't know if it was that period of time having the discussion about the details of the circumstance, but when you call 911, you speak to someone that actually can assist you and guide you, but what they do immediately is prompt that call for paramedics to get there. And in this case, if you recall, paramedics got there in 6 minutes. So you can potentially be on a call longer, because unfortunately I've been in that circumstance myself, but the call that's initiated to the fire department and paramedics, that happens instantaneously. So I think there's different ways to look at what you're asking.
is it your position that even if Michael Jackson self-medicated with excessive amounts of lorazepam and bolus pushed 25 milligrams of propofol, that Dr. Murray is still responsible for his death?
Absolutely.
Would you think a doctor that prescribed a patient 30 Ambien and the patient took them all and killed himself, that the doctor would be responsible?
Objection, irrelevant. Is that okay?
Nothing further at this time, Your Honor.
Mr. Flanagan, thank you. Redirect examination by the people. Mr. Walgrave.
Thank you, Your Honor. Dr. Kamangar, I want to follow up on Mr. Flanagan's hypothetical in which Mr. Flanagan fell to the floor and had some type of arrest right here, okay? Now, as a qualified medical doctor, if Mr. Flanagan fell to this floor, you would not wait 12 minutes and then call Mr. Flanagan's legal secretary and then tell that legal secretary to send a law clerk upstairs to assist with Mr. Flanagan, who's dying on the floor, would you?
I think that's a hypothetical.
Objection?
Yes.
Sustained. Objection?
Yes.
Sustained. You may rephrase.
Would you wait 12 minutes to call? Let me just ask you. You would call 911 immediately because you would know you were lacking the emergency equipment and everything that was necessary to save the individual's life, correct?
That's absolutely correct.
And that not only is that a moral and professional obligation, it's basic common sense, isn't it?
That's absolutely right. I mean, that is putting your patient first.
Now, you had been asked about dehydration. I think you wanted to elaborate on something regarding Dr. Murray saying that he had given saline for dehydration. What was it that you wished to elaborate on?
Right. What I was trying to say was that I did read that in the transcript, but
The objection is overruled. Please.
that he mentioned that as being a problem when he was interviewed by the staff at UCLA Medical Center that asked about what was going on with him. So I think there was that persistent concern even at that point.
Okay, thank you. And regarding Dr. Klein's medical records, those were provided to you by me, correct? So you could review them?
That's right.
All right. And in those records, you reviewed the records for the months preceding Mr. Jackson's death?
That's right.
All right. And in Dr. Murray's interview with the police, he mentions on multiple occasions that he was personally fully aware of Dr. Klein, and he knew at least 3 weeks prior to Michael's death, he was aware that Michael Jackson was seeing Dr. Klein, correct?
That is correct.
Now, the sleep article that Mr. Flanagan was referring to, that's from 2010, and it was out of an experiment in China, correct?
That's right.
Okay, and I think you were very clear earlier specifying the differences, and that was an experiment in a hospital setting to see if in the future propofol could have any effect in treating a specific type of insomnia, refractory insomnia.
In a very highly monitored type of setting, using a very precise drip over a period of time like they did in the study, over 2 hours.
And again, even the authors of that study indicated it was simply an experiment and that future study would need to be done.
That's correct.
So what Dr. Murray was doing with Michael, with his treatment with propofol to treat insomnia, truly Michael Jackson was being subjected to an experiment by Dr. Murray.
Yes, without the appropriate precautions.
And there was no diagnostic workup, there was no lab work, there was no history, there was no pharmaceutical history. So from the records you reviewed, Dr. Murray had no idea not only if Michael Jackson truly had insomnia, but even what type of insomnia.
That's right.
I want to ask you a little bit about the doctor-patient relationship. That is a unique, special relationship between a doctor and a patient, is it not?
That is correct.
Can you describe fundamental tenets of that forms the basis of a doctor-patient relationship?
Well, I think the most important thing is putting your patient first. That is really, when we describe the Hippocratic Oath, the kind of the ethical, moral standards that doctors really have to abide by, is really putting your patient first and doing what's right for them. Knowing your limitations, knowing when something is beyond the scope of your practice, knowing that some things that patients may ask for may not be in their best interest, and knowing when to say no.
And knowing when to say no. In this case, specific to this case, if we assume is true that Michael Jackson requested that he be given propofol, and you as a qualified doctor knows that that is not only inappropriate but life-threatening, you have a professional, moral, and ethical obligation to say no, correct?
That's absolutely right.
No matter how much the patient may complain, no matter how much the patient may beg, you as the doctor have the obligation to say no.
That is absolutely right.
And who makes the final decision when deciding what is appropriate care? The patient or the doctor? Your Honor, could I ask Dr. White to please sit down? It's kind of distracting to...
If we would, please.
Thank you. Who makes the final decision as to the appropriate care? The patient or the doctor?
It's the doctor. I mean, again, your patient's welfare is first and foremost.
Now, Mr. Flanagan was asking you about the record keeping and Dr. Murray's ability to recall important facts or inability to recall important facts, and you reiterated that you need to have the records so that you can accurately ascertain the treatment and also accurately detect trends. In other words, maybe a trend in a decreasing or increasing blood pressure or an increasing or decreasing oxygen saturation, correct?
Correct. Particularly a decreasing oxygen saturation.
And in the defendant's interview, there's a perfect example, is there not, about his inability to give precise information as it relates to the oxygen saturation.
That is correct.
And on page 63, line 9, Dr. Murray indicates that prior to leaving his patient for what he said was 2 minutes, he indicates, quote, "I monitored, saw his oxygen saturation. It was in the high 90s, 90%. High 90s and 90% in the medical world are profoundly different numbers, are they not?
That's very, very correct. I mean, if you're starting off with an oxygen saturation of 99 or 100%, and then soon after your oxygen saturation is 90%, that is a very troubling trend. And that is, again, goes to why it's important to have these records. We're just not doing it to make life difficult for ourselves and for nursing staff. We do it for these reasons, so that we are able to follow trends and know when they're warning signs.
Okay, and from his statement here, it was in the high 90s, 90%. There's really no way to know which number he's referring to.
That's right.
And there are no records to look at to determine what the vitals were and to determine what that saturation level was.
That's correct.
Now, you were also asked by Mr. Flanagan in a hypothetical sense, could a doctor be grossly negligent and the patient survive? Do you remember that?
Right.
Okay. A doctor could be grossly negligent on a certain factor, and God willing, a patient could survive, correct?
That's right.
Okay. In this case, I want to talk about this case. Conrad Murray was grossly negligent in multiple instances, and that gross negligence directly caused the death of Michael Jackson, correct?
Absolutely did, yes.
Thank you, Doctor. Thank you, Your Honor. Nothing further.
Mr. Wellman, thank you. Recross, do you need a moment, Mr. Flanagan? If you'd like, do you need a moment?
I'm okay.
All right, thank you. Recross by the defense.